Reinke'S edema. It is a benign laryngeal condition characterized by diffuse gelatinous swelling of the superficial layer of the lamina propria, that is Reinke'S space. It is strongly associated with smoking and voice abuse, also known as polypoid vocal cord, polypoid degeneration of the vocal cord, polypoidal hypertrophy, chordal polyposis, polypoid corditis, chronic edema of the vocal cords, and pseudomyxoma or pseudomyxomatous laryngitis. It is strongly associated with the smoking. It occurs almost exclusively in a moderate to heavy smokers, although the exact role of smoking in these group is not known. Some studies have also suggested the voice strain and LPR may be associated with this development, although the importance of these factors is not clear. Hypothyroidism may be found as concomitant associated pathology in these cases. The epithelial shows non-specific changes and the basement membrane layer is usually thickened. In linkage space, there are leaks of the edema, extravasated erythrocytes and thickening of the walls of the subepithelial vessels as you see in this picture. It is more common in the male, about 40 to 60 years of the age group, and voice changes are mainly hoarseness of voice, gravelly or husky voice, lowering of the pitch, especially in the woman, dyspnea, stridor, and symptom often associated with LPR. On 90-degree scopy, the diffuse region of membranous part of the vocal fold are seen bilaterally about 80% of the cases. There may be asymmetry. Typically, the vocal folds are gray and yellowish in color with prominent superficial vessels. Alternatively, the edema fold may appear diffusely red with coexistent extraesophageal reflex symptoms. A severity grading system that is proposed and validated by Tenet et al. Grade 1 is marginal age edema. Grade 2 is obvious sessile swelling. Grade 3 is large bag-like swelling filled with the fluid. Fourth is the partially obstructing lesion, and that is complete contact of the membranous vocal fold. DD may include vocal fold polyp, vocal cord cyst, neoplastic lesions, and chronic laryngitis. Management include absolute smoking cessation, voice rest and therapy, control of reflux disease, treat hypothyroidism if present. Principle of surgery in Reinke'S edema: reducing the bulk of the mucosa, mass per unit length of the vocal fold, obtaining a straight mucosal edge, avoiding leaving small deposits of myxoedematous material behind this mucosa, avoiding damage to and exposure of underlying ligament, thereby reducing the chances of scarring and web formation. And this is done by microlaryngoscopic phonosurgery, by microflap technique, or you should aspirate or remove gelatinous material behind the mucosa. Surgery in Reinke'S edema cases is known reduction glottoplasties. It can be done with KTP or CO2 spot laser. Care should be taken not to remove or excise the epithelium, not to overexpose the vocal cord ligament or overheat the vocal fold ligament. The myxomatous material in the superficial lamina propria should be removed or aspirated, and this redundant mucosa should be excised properly so that both vocal cord edges should be matched properly. Some report has been very good even with unilateral treatment and stopping of the smoking.